with COVID.
Okay. So we got doctors here from all over the country tonight. And one of the, our patients have been asking, I don't know about you guys, but my patients have, everybody's been very curious about, you know, what's happening in the COVID world, whether we can come out of this, you know, lockdown quarantine that we've been in for the past 7 months. And with the news this week of the vaccine from Pfizer and the antibodies being approved for emergency use from Eli Lilly, people are asking a lot of questions. Are you guys getting questions about that from your patients as well?
Yeah, sort of.
Yeah.
They asked me if I would take the vaccine.
Mm-hmm. Yeah. So let's talk. I'm very curious also to hear from you guys what you would do, because the patients are asking, because they'll kind of follow what we advise, but more importantly, they want to know what we would do, right? So it's interesting, this vaccine. First of all, it's going to be a little bit of a problem getting distributed, because it turns out it needs to be like negative 90 degrees. So it has to be on dry ice.
-80 Fahrenheit, yeah.
Yeah. So it's kind of like when we do the stem cells, it has to be on, they have to ship it on dry ice, and then you have to keep it in a cryo freezer. You can't just keep it in a regular freezer or put it in liquid nitrogen. So it's going to be a little tough getting it distributed. So it's probably not going to be distributed to the typical doctor's office. And we don't know what the, how long the immunity is going to last.
Right.
Yeah. Have you guys heard any news on what they think? I guess nobody knows, right?
Yeah, they only know the result from the fact, I guess less than 100 people got sick from the virus, and of those people, most of them were in the placebo group, that they didn't get the vaccine. That's why they got sick. So they're drawing the conclusion based on that.
Yeah, that's how they got that 90% number, right?
And but then we don't know how long, because this is however long they tried the vaccine for. So we don't know how long they have the immunity for.
Yeah, if it's anything like the actual diseases, I have a lot of patients who actually had COVID early on, and most of them still have antibodies, but I can tell you at least a handful of them have lost their antibodies already. So we're looking at about 7 months if they have natural immunity. So I think it's, realistic to think that the vaccine will probably have a limited amount of immunity as well, right?
Yeah, I would want to know, I think they need to be very open about how this new vaccine technology works, because it's an RNA vaccine, and in order to make it, RNA is not stable outside the cell. So in order for this to be effective, they need to use some type of vector to get that RNA inserted into your cell, and in order for that to work, basically. So I think there's a lot of unknowns right now. And that, there's this thing called, once it's approved, then there's the process of something called post-market research. So that's when they collect all the data of all the side effects.
Yeah. So how many people were in the trial? Do you guys know? I think
I don't
This is
remember.
a spotty connection on my end. I don't know what's
Yeah,
going on.
I mean, I think it's something like 40,000, and normally it's like they need 500,000, right? So, yeah, so
I
there's a
don't
lot
like
of,
the idea. Yeah. I don't like the idea of them having to use something to insert a genetic sequence into my cell. That's the only way it's going to be effective. So they probably use an adenovirus vector of some sort or some type of transposon jumping gene sequence. Who knows what that's going to do to your genetic code and your offspring's genetic code. Is, you know, these transposons, they cause your genes to jump around. There's a lot of unknowns here.
yeah, and for it to work, I think if there's a limited time span, I think we have to vaccinate like the majority of the population at the same time. Otherwise, you know, we're just going to be playing musical chairs with this thing, right?
What's
So,
amazing is even some of the brightest doctors that I've spoken to, they still think it's the traditional vaccine, you know, an antigen, right? Or a live attenuated virus of some sort. They have no clue. This is genetic. Basically, it's gene therapy. It's gene editing.
Sunny, let me ask you, I had the same question, but why would they need, if it is integrated in our cell, then one dose would be enough. Like we'll be forever, the rest of our life, make that antigen, that spike protein, right? That
Well, probably because the virus mutates, you know. So it's like, you know,
no,
your virus, there's so many different strains.
the same, you mean the two doses that's, I think 3 weeks apart, you think they use different kind of, like a mutated?
Oh, why do they need to build it up?
Right.
Yeah. Because you know, it's in your somatic cells and not your germline. So if it's in your germline, then yeah, your offspring is gonna have it. But your somatic cells, it's got to integrate with all your cells.
yeah, so yeah, this is going to be presented to the lay public, so we have to kind of keep the, you know, scientific talk to, you know, to make it, you know, make sense to people. So I guess the bottom line is we don't really know. It's certainly good news that we have a vaccine that's 90% effective, but the trick is to get it to people and to get people to take it. The other news that we got was the emergency use approval for Eli Lilly's, and I have to read it because I still can't say it. Bamlanivimab, which is antibodies. And for you know, for the people that are listening, I think you know, a lot of my patients were asking me, you know, they're thinking that this is another vaccine. Like, how is the antibody treatment from Eli Lilly different from a vaccine? Does somebody want to tell us?
Yeah, what I understand is it's a monoclonal antibody. So it's purified from, like, it's different from the convalescent plasma of people who got the disease. So this is a manufactured monoclonal antibody. I think it's in an infusion form. I don't know how long it takes to get through. And I saw some information about Medicare covering like a infusion center or like outpatient setting. People can receive the this infusion.
Mm-hmm. So this is for people who are sick, who've contracted the virus. This is not a prevention.
Right. So it helps them fight I think it applies to a mild to moderate disease to prevent them from progressing to the severe form. Yeah.
So, so this works kind of like the convalescent plasma, but instead of getting antibodies from the patient,
Right.
getting it.
Right. So they say the convalescent plasma, there's evidence that it doesn't really, like ultimately the net result, it doesn't really save life. Because there's also like clotting factor, I guess has to do with the PR, with other factors in the serum. But with the pure form of monoclonal antibody, you're only getting the antibody to fight the virus without the other risks.
And I guess this would be easier to manufacture.
Right. So it's like a synthetic, I guess. It's not.
Because it's
The,
cloned, right?
yeah.
Yeah. So.
Bill,
Mhm.
I have not had anybody question any of this in my practice.
Mm-hmm.
Nothing. No, they've heard about the Pfizer thing and that's it. Now in New York, we never know what's going on over here, but there's a little buzz about things shutting down and nobody really knows. But in my business, and I got people, thank God for the hormone part of it, and I've been doing all my other procedures. I can tell you I have not stopped on anything. It's been great, except for the fact that I need a vacation. It has been great. I don't know. I'm not gonna discuss any of this with any of my patients. It's either whatever the government's gonna give, and if it's gonna happen in the spring or whenever, and life can go back to normal, or it's going to be all this political stuff, which I'm not going to get into. But I don't know what you guys are going to get any of this, because it is what it is.
Well, what we want to do is help the patients try to figure out, because at some point they're going to have to make a decision whether to get the vaccine or not if it becomes available. But
they're going to do it with their primary doctors.
Yeah. Well,
which I'm not anymore, so I'm certainly not getting involved.
But you do, what you do, for the people who don't know you, Jack is in Buffalo, New York, and he has a cosmetic surgery practice as well as a very robust hormone, bioidentical hormone clinic. So let's talk about things like hormones and peptides and vitamins.
Right.
Those are some things that people can do right now to help them either avoid getting sick or to keep their immune system. And we also have Dr. Juan Chavez from California. He also does a lot of hormones.
But that's what I'm saying. We're doing a big push now with Nutrimetrics, and we're specifying certain supplements and certain things. I'm actually doing a Facebook Live on isotonic vitamin D3 on Friday morning. You're absolutely right. From that perspective, not just for health but for the business, that is a very good thing to center on. Now, I have a big listening audience because I have this bioidentical hormone practice for a very long time. So, I can feed into that. And that not only helps them, but it helps my bottom line. But you're right. But as far as the vaccine and all that, I'm not going to get into discussing that with people. I'm not well versed in that, and I'm not going to try to be. If I want to try to be that, I would go back into primary care medicine, which is never going to happen. And that's the way I feel.
So, for people,
right, Tammy?
There's two things. There's things that they can pick up at their pharmacy over the counter. And then there's things that they can go to doctors like us and get either injections or pellets or creams that can boost our immune system. So
I know Juan is sort of on the same page as me, because he kind of does what I do. Yep. And I think if you get a good quality supplement, that is a good, and we're talking about business here. it's not a bad thing to do. It's a good thing to do, but it also brings in more to your business and brings in more to, you know, what you stand for. So again, that's a very good thing, especially in a time like now where nobody knows about shutdowns, this, that, the other thing, you know, the whole nonsense again. I think we have to have, and I've said this to you a million times, and to Tammy, and the only other one I know that kind of does it is Juan, is you have to have a backup plan if you want to stay in business.
Yeah. So, yeah. Sonny, do you do hormones too? Kenny, Dr. Kim?
Yeah, no, I don't do hormones, but
Okay.
on sort of on the line of therapeutics, my practice is predominantly pain related, and we're getting into aesthetics as well. But what has happened is that because of our reputation with difficult conditions, a lot of folks have been reaching out to us as it relates to COVID because they're not getting the answers. They're being ignored, and they're not getting treated by their primary care doctor. They're being told to just, you know, just wait it out, go home, you know, isolate for 2 weeks, and they're like, well, why do I go see a doctor? So we've actually had quite a few patients who came in, and we did intravenous ozone, intravenous vitamin C, and some really sick patients turned around within 4 or 5 days, completely asymptomatic within a week.
Yeah, but that's what I'm talking about. You're doing what I'm talking about.
And so, you know, I think the emphasis should be on therapeutics, but there, you know, obviously the media has really pushed the pharmaceuticals, which is a whole lot more, you know, obviously it's a lot more, you know, it's all about the money basically. And then they're suppressing intravenous vitamin C. They're suppressing intravenous ozone. And these are such powerful, readily available, inexpensive, and easy to implement. So you know, the vaccine question really hasn't come up a whole lot in my community. But a lot of patients are they're really fed up. They don't want to wait for a vaccine. If they're sick, they want treatment.
Yes. Yeah, and who knows how easily we can get the antibody treatment, even if it is available, and it's an IV treatment as well. So as far as what patients can do for themselves, Dr. Polit, Dr. Chavez, do you guys have any suggestions for patients in terms of, you know, suggestions for vitamins or?
Sure. So on a basic level, vitamin C, vitamin D, and zinc are crucial and have been shown to shorten the length of duration if you do get COVID. The other super simple thing you can do is just a lot of people have gotten pressed and in hunkering down, and they've gained a lot of weight. And you know, one of the most basic things you can do is just work on your gut health, as far as stopping the junk food, the packaged food, and the high sugar items, and switch back to natural fruits and vegetables, which are still readily available, and really working on daily exercise. Those things, basics, and do the basic essential vitamins of D and zinc. Those really can help you so much in just maintaining a general health level. I don't know, Dr. Chavez, if you have recommendations beyond that.
I would also recommend melatonin at bedtime, 3 milligrams. It's great for the immune system, a great antioxidant. And I would also recommend, if you're low on your DHEA, it's also very good for your immune system. And like you said, you know, exercise, weight loss, keeping your body fat down, getting plenty of sleep, 7 to 8 hours a night, uninterrupted sleep, and washing your hands, and just being mindful of others, you know, staying away, keeping 6 feet apart at least. And so I work here in the ICU, so we do the medications, the remdesivir here. We use convalescent plasma. We're using the Decadron, and we're using the anticoagulants, anticoagulation medications. And so that's the hospital side of it. And of course, like we mentioned, what people can do to prevent COVID infection.
Yeah, so I think we're at a very different place now than we were 7 months ago, early in the year. Back then, we didn't know much about this virus at all. We didn't know whether, it was spread by aerosol or by droplets, or, how contagious it was, how deadly it was. We knew it was more deadly than the flu, and at this point, it looks like it's about 4 times more deadly than the flu, because in a bad year, the flu may kill 60,000 people, and so far it's killed over 240,000 people. So I'd say about 4 times more deadly. If we can get the death rates, if it can make it less deadly so that it's kind of similar to the flu, I think people will be able to kind of accept that level of risk. And the things that we just discussed, I think, are things that, certainly things that the doctors, unfortunately, it's not all doctors are not really open to some of the things that we're talking about. And some of them are very, very simple things, in the vitamins. And I'm just still surprised that so many people don't even know about vitamin D, vitamin C, zinc. Those are things that, and melatonin you can get over the counter. Those are things that everybody can do right now to improve their chances of either not catching it or surviving it. So the final thing I wanted to talk about, because there seems to be some confusion, are the masks. How to best use the masks. So we have this, like a typical surgeon's mask, and this is probably the most common ones that you see, that and these cloth type of masks that we use. And then we have the,
I listened to a lecture today on this.
Yeah, we have the N95, and then we have the KN95, right? Yeah. So does somebody want to take a shot on explaining the differences for us?
On which rating from 1 to best?
Like what situations should we use what masks, and how best to use them? Because people don't know, some people think that, they need to wear an N95 mask all the time, which is not really practical because it's very hard to breathe through it, so.
Well, if you want to be well protected, I think a good quality N95 or a N95. Now, if you're using a cloth mask, you're still going to be able to be at risk for airless, for infection, for contracting COVID. So and if you have a 2-layer cloth mask, that's even better. But yeah, I mean, it's better prepared. The better the mask, the better you're protected. I mean, it's pretty simple. I mean,
yeah. Now, Dr. Chavez, you're in the ICU. You're actually intubating, putting airways into patients who have known COVID. So in your case, I think there's no question you need an N95 mask. You need to make sure that it's very properly fitted.
I use a PAPR. So I use a shield and everything. Yes.
Yeah. So what if somebody is out shopping at a grocery store?
Question. Some form of mask, at least. I mean.
Yeah. The difference is that when you're working with a known COVID and you're having prolonged contact, you have to prevent any kind of air to get into your system without going through the filter of the mask. Whereas if you're out in public and you have, you know, you're just generally, I mean, these type of masks are really to protect other people from you, because, you know, even the KN95s, which have good filtration, don't fit as snugly, you know.
As the N95,
Yeah,
right?
you still have air coming around the side. So this is not good for you when you're in the ICU, but this is very good protection. Now, how about when you're in a plane, when you're on a plane?
I've used the KN95s.
Yeah.
I've used those right there.
Mm-hmm. So, yeah, I mean, I agree. I think either a KN95 or an N95, and the N95 is going to be better. But the reason why I think that, you know, this might have a little advantage is because if you're on like a 5-hour flight, and I can tell you from personal experience, when I was working at the COVID hospital and had to wear the N95 mask for 12 hours straight, it's very difficult to keep that thing on and to breathe through that. You know, at least the KN95 is a little bit easier to breathe through. But I wouldn't sit in a plane with one of these, because
Right.
I don't think it's enough protection.
I do have a couple suggestions for the general public when they're wearing the masks. Very frequently, the first one is very frequently you see people who just have the mask over their mouth and under their nose, and is not going to be helpful at all to have it that way. So you want to cover the mouth and the nose, and you want to pinch the little metal bar down onto the nose, so that you're filtering as much of the general air as possible, so that at least the large droplets are not getting in when you're trying to breathe. And the second, I think even more important suggestion that I see people doing all the time is you leave when you put the mask on, you need to leave it on. And when you take it off, you should take it off with the little strings around your ears, because every time you touch the front of that mask, which has filtered all of the air, all of the germs would be on the exterior of the mask. And when people keep adjusting the mask from the outside, they're literally contaminating their hands. And then they take the mask off, and then they touch everything with their hands before they wash them. They defeat the purpose of the mask. So it's really important not to touch the front of the mask. Once they put a clean mask on, take it off by taking it off around their ears, and not touch the front of the mask.
Juan, I think you're muted.
Oh,
I am. I'm giving instructions.
Oh, okay. I thought you're. Okay.
I know. I was talking to my colleague over here.
Okay. So, one thing, I agree with you, Dr. Polit, with, you know, I see people with this all the time, and, you know, even though that's not ideal, I think it's better than not wearing a mask, because at least if you cough, you know, you're not projecting all the droplets out to everyone around you. So I'd rather see somebody do this than to not wear the mask, because
the funny thing is, when people cough or sneeze, they take the mask off.
don't take your mask off when you sneeze. Yeah, I've seen that too.
Yeah.
So, yeah, I mean, I think these are some practical advice that, you know, I think we had some information that people may not have already known. And I think, you know, the key is that we just need to, you know, I mean, it is getting better, even though it may not seem like it. Like I said before, we are at a different place right now than we were early in the year. So with the vaccine coming out, with better therapeutics, we still need to kind of, you know, do what we need. We can't go back to doing everything we used to, but, you know, I personally don't feel like I'm in any danger going to the grocery store or even, you know, walking around in a mall. I think it's the enclosed spaces. You know, I wouldn't go to a movie theater just yet. I'm not sure if I want to go back to the gym yet. but you know, it's
I'm back
certainly
at the
not.
gym.
What's that?
I'm back at the gym.
Are you?
I
Yeah.
I use just a workout mask, and I do wear it under my nose when I'm on the treadmill.
Mm-hmm. Yeah.
But
I mean, but you're not.
and
But you're
the-
also
and the
keeping
gym-
distance.
right, and the gyms are very light right
Yeah.
now. I don't think a lot of people want to go back right now,
Mm-hmm.
and you got to stay healthy.
Yep.
I'm going to the gym to avoid the complications of COVID.
I think the gym actually, the danger in the gym is touching stuff. You know, when you're touching weights and touching things that other people have touched more than the air, because it's, you know, you can keep the distance. So you have to be aware of that.
Right?
Yeah.
It's-
So, well, yeah, I want to thank everybody for coming on and talking about this. And, you know, if things change, we might need to do this again. I'm just going to turn off the recording now.